Good morning guys. So in this vlog I'll be talking about my day-to-day life in anesthesia department, and now I'm officially PG2. Yes, the juniors have come and I am kind of like orienting them with the department and everything. Today I'm heading out for my conference which is in Max Hospital Vaishali. It's a toxicon. The entry was free. I'm really excited for this conference because it's going to help me deal with critical care better. We often get poisoning cases in our ICU. Sulfurs poisoning is very common out here in rural areas, so I'm really excited and I'll fill you in on it. Here are some skills that you need to know before joining first year PG in anesthesia. It will give you an edge over all your batchmates. So first of all, we will begin with preparing the OT, and OT preparation begins with arranging for all the OT instruments: laryngoscope, ET tube, eye gel, fixer. These are some of the basic things. Next, you have to check the workstation if it is properly functional. You have to do the leak test and check the Baines circuit. Then you have to load general anesthesia drugs. Over here, we used isoflurane and propofol as the main induction agents. Other than that, we also load mefetropin, ondan glyco, butrum, diclodexa, sucol, midaz, loxicard, and vecuronium as muscle relaxant. Once you're ready with the drugs, you have to check for the other things like blanket, fluid bottle, IV stand, etc. Okay guys, so I just prepared the gynae OT. Now I'm going to the ICU to relieve my colleague because she's going to go for a CT with the patient. I guess the patient's intubated. Once you're done with the GA drug loading, you also should know how to prepare the OT for spinal anesthesia. You need a Quinky needle 25 gauge along with the same emergency drugs as the GA ones: mefetropin, ondan glyco, and anavin heavy 0.5% as the spinal anesthetic agent. You should know the layers that you're going to pierce while giving spinal anesthesia, and you should know how to feel the space using the two first line, which extends from anterior superior iliac spine to the point where the vertebra crosses this line. That is where you see the L3, L4, and you have to hit in the space between L3 and L4 after feeling loss of resistance in the subarachnoid space. Another important thing that you need to learn in your first year of anesthesia PG is calculating how much fluid you are going to give your patient. It is done by the Holiday Singar formula, by the 4-2-1 rule, where you multiply 4 into 10, 2 into 10, and 1 into the remaining weight of the patient, and then you get a certain value. That value you multiply with the number of hours of NPO the patient has been, and the answer you divide into two parts. Then to each part you again add the value that you calculated in the first step. So the first half will give you the fluid in the first hour, and the second half you again divide into two parts to get the fluid for the subsequent hours. You also need to know the MABL formula, which is maximum allowable blood loss. After that, you need to know the steps and the drugs used for rapid sequence intubation. Other than this, you will also learn about managing patients in the ICU, how to monitor them, how to get their workup done, how to talk to attendants, how to get consent for central line, how to insert a central line in the internal jugular vein or the subclavian vein using an ultrasound guided technique, basic ventilator modes, how to wean a patient from IPPV mode to SIMV mode to CPAP, and then extubate a patient. So you will learn how to write ICU notes. You can use all these skills in your locum duties that you can do on weekends or whenever you're free for learning extra whenever you're off duty. Even if you are unable to intubate a patient in your first year, the least you can do is put them on Baines circuit and do bag and mask by the C&E technique and jaw thrust chin lift maneuver. As long as you keep doing that properly, the patient's airway is going to be maintained and the patient will be saved. Also, you need to learn how to do pre-anesthetic checkup or PAC. You need to know the Malampatti grade, Met scale, ASA grading. You need to know how to assist a patient in MRI by inducing them. We usually use ketamine for children for MRI. Also, you will learn how to cannulate a patient in the external jugular vein, which is very interesting. So, these are certain little things that we learned day by day, and today we are able to master them and teach them to our juniors so that they can be well equipped for the OT, and they also learn all these tiny little tasks that they are expected to do as a first year resident. Other than this, you will also have a paper and poster presentation in your first year, for which you need to attend conferences and present your paper and poster based on a topic. You also need to choose your thesis topic and submit the thesis protocol and give the BCBR exam. Hey guys, so I'm on 24 hours duty on this Sunday, and just asked in the labor room, there's a patient in labor, so we have to keep a tab about the labor room status in case we have to prepare for an emergency LSCS.